This morning in Health Watch, prescription sleeping pill risks. The Food and Drug Administration reports that Ambien, Halcion, Lunesta, and 10 other medications have side effects that can be very dangerous. And our Dr. Emily Sine is here with details. Good morning.
Good morning, Harry.
What kind of side effects are we talking about here?
Right. Well, the FDA wants the manufacturers to beef up the warning label on the packaging and also to create patient education information that would be given to patients about two major side effects. The first is an allergic reaction. Now, this is rare, but this would be an allergic reaction. Sometimes people's face can swell. It can be very dangerous, even fatal. It can happen the first time that someone takes these medications or any time thereafter. But again, this is rare.
It's certainly something to be aware of. Okay.
Absolutely. The second one is the one that's gotten so much attention. This is called complex sleep-related behaviors, the most famous of which, of course, is sleep driving. People who take these medications drive their cars and often have no memory surrounding that. But it's not only sleep driving, less dangerous behavior. Some people have painted doors at night, not realizing what they were doing, waking up the next morning, finding out that there's wrappers all around their bed, having eaten food, and again, having no memory surrounding the event.
How widespread is this, though?
Well, that's one of the problems. There are no clear statistics exactly on how big of a problem this is, but what you have to keep in mind is that millions of people are taking these medications, and even rare side effects, when it starts to be used in millions of people, can actually become, you start to hear about them even more.
Well, this whole thing, use only as directed.
Absolutely.
And that seems to be a real source of the problem.
Let's talk about that. You have to set aside 7 to 8 hours of sleep. Taking these medications and not giving yourself time for the medications to pass through the body is a huge problem. A lot of people take them, they don't feel anything, so they take another one. Don't add to the prescribed dose. If it's not working, tell your doctor. It may mean that you want to switch to a different medication rather than increasing the dose that you're on. You've got to be aware of drug interactions, particularly if you're taking another medication that might make you drowsy or might act as a sedative.
And some of them don't interact particularly well either.
They don't act well, and there's one more thing that a lot of people are doing. In fact, they're saying that some of these cases are probably the result of this, which is combining these medications with alcohol. That's a big no-no. They already list that on the packaging insert. However, they're going to beef up warnings about that. So using them correctly could reduce the risk of all these rare side effects.
Now, is the FDA saying stay away from these things or just...
Right. They're not saying stay away from these medications. Used correctly under the supervision of a doctor, being aware about the complications that can occur with alcohol and other medications is very important. Very often people see more than one doctor. If you're seeing more than one doctor, make sure all your doctors know the medications are on.
On the same page. That's right. I wonder why I had a blue door. All right. Dr. Emily Sine, thank you so much.